Well, hello and welcome back to Test Drive Live. I'm your host, Sarah Lee Dobbs, and today we are going to be talking about Apos. And as always, feel free to participate in our live chat if you have any questions whatsoever. So, let's get started. Now today, you are all in for an exceptional treat because I have a very special and beloved guest who's going to be joining me. And I know that you've heard his voice sometimes on the other end of my home videos, so now you actually get to meet my partner in crime, my husband. So come on in, Doug. Come and join me on the couch. Yes. So Doug, this is your...
Welcome.
Thank you. This is your first time actually at the studio.
Yes,
isn't it? I know
very
you've
first
met
time.
Jason, our producer, and some of the other guys. So what do you think of our fancy studio here?
Very fancy. Very nice.
Yeah, it's very
This
nice,
is where you're
isn't it?
spending your evenings.
This is where I'm spending my evening. Yes, I am at work, Doug, I promise. I'm
Okay.
always where I say I am. So now we are both here today to talk about something that a lot of us struggle with. In fact, 25% of people struggle with knee pain, and Doug and I are no different. And we both got the opportunity to take the Apos therapy for a test drive. And wow, we were both actually shocked, weren't we? And
Yeah.
really surprised at the relief we
Impressed.
both felt. And I'm really excited to get into this with all of you. And I want you to understand this revolutionary treatment for yourselves. So you might be asking yourself, what is Apos therapy? Well, it's an FDA-cleared medical device clinically proven to reduce chronic knee pain, also known as knee osteoarthritis. Now, the best part is that you only wear it for about an hour a day at home when you're going about your normal routine. Now, you actually start with about 15 minutes a day, and then you gradually build up to about an hour. Now, what is really, really important for you to know is that Apos is covered by many insurances and can help you get back to doing things that you want and love to do. So, let's have a listen to the company and let's hear what they have to say about it.
Some people believe that chronic knee pain is a life sentence, suffering through pain relievers and injections while the pain keeps getting worse, until everyday activities become unbearable and life becomes a series of disappointments. Well, the good news is, it doesn't have to be that way. Meet Apos, a knee treatment based on a shoe that is personally tailored to shift the pressure away from the knee's pain zones. By wearing them for as little as an hour a day, the muscles develop better movement patterns and the pain subsides. Apos can be done at home while going about your normal routine, while working on a computer, cooking, talking on the phone, or watching TV. And it is FDA cleared, clinically proven, and has a 96% satisfaction rate with patients. Apos helps people move better and live better, and get back to doing the things they love.
Oh, I love their promo videos. What I'm really hoping is, though, that by wearing these for a few more months, I'm going to have gorgeous skinny legs, just like that lovely cartoon character.
Like olive oil.
Oh, I know. Well, I've got the hide. I haven't got the skinny legs anymore, but that's okay. Well, we're going to take a quick ad break, but when we come back, we will be unboxing this fabulous product. We'll see you soon. So welcome back. So we are going to be getting to the unboxing part, the most exciting part of the show. So the first thing I do want to talk about is this fabulous little bag that they come in. And I really do think, and I haven't asked Nina this, Nina's our lady that we speak to, who did all this work for us on our feet for these shoes. If there was a big amount of thought that went into creating this bag, because it is incredibly comfortable. You know how there's certain bags that you should wear now that doesn't hurt, your back, like, all these school kids that go around constantly in these backpacks with so many books in. This feels so light, and the shoes are a little bit heavy, but I actually think it looks really, really trendy, and it's very, very cute indeed. So you do get this little bag, which they come in. And then now let's get to the footwear. Now, we only have the lace-up ones to show you today, but I do believe that they do come Velcroed as well, if you didn't want that. So here they are. This is what they look like. When I first tried them on, they did feel a little heavy, I have to be honest. Do you remember, I'm sure they still are saying, do you remember? You know what clogs are? I think they started in Holland, and clog dancing, that was a thing. Well, of course, I know all about this, being a former dancer. They did feel a bit cloggy and a little heavy. And I was definitely tap dancing around my kitchen when I first put them on, but it doesn't take too long for you to really, really get used to them. And the top part is so soft. It really has some wonderful cushioning. And they're a neutral color. I mean, they don't need to look beautiful. No one's going to see you wearing them. You're only wearing them in your home or maybe your office. You know, you don't have to just wear them at home. You can take them to office with you. That's more convenient. I started off with 15 minutes a day, and then I'm now up to an hour. So I'm just going to put these here for you, and so you can see the bag as well. Now I'm going to go through some of the features and bullet points, but I also want you to have a look at Doug's feet. He's going to walk in them just a little bit, so you actually can see what they look like on the foot. You will get to see that on the home video. So let's talk about the bullet points. Customizable foot-worn device, biomechanical adjustments for pressure redistribution. You can use them at home for about an hour without changing daily routine. Data-driven personalization based on gait analysis. Non-drug and non-invasive treatment. FDA-cleared ongoing clinical support designed to retrain muscles for healthier movement. Addresses both symptoms and root causes of pain, and suitable for knee, OA, hip pain, and lower back pain. And as I said before, it is covered by leading insurance providers. As I've already said, that's absolutely huge. And shifts pressure from painful areas, retrains muscles for healthier movement, and treats symptoms and the root cause of pain. Decreases pain and improves function. And with over 150,000 patients worldwide and significant healthcare cost savings, Apos revolutionizes how we treat and manage these conditions. And in a clinical study published in the Journal of the American Medical Association, 70% of knee osteoarthritis patients treated with Apos reported a 70% reduction in pain after 6 months. 86% of patients who are experiencing severe chronic pain and in need of total knee replacement reported that Apos system delayed surgery after 2 years of treatment. Now, Apos therapy can treat a variety of knee conditions, including meniscal tears, you know all about that, don't you? Pain, dysfunction, patella tendonitis, and patella tendinitis. Have I said that right? Come on, you're better at medical. What does that say? Go on.
Tendinosis and patella tendonitis.
All right, show me up. He's the medical one here. Cartilage defect, osteoarthritis, quad strain, hamstring strain, calf strain, ligament tears. So much. Well, I know you guys at home might be asking yourself, who are the prime candidates for Apos? Well, mainly people aged plus 40. Then why am I doing this show, Jason? Why am I doing this show? Plus, what's going on? You're not my friend anymore. People aged plus 40 suffering with chronic knee osteoarthritis pain or lower back pain or hip pain. Now, 60% of them are women, which I do find that really, really interesting. And I need to do a bit more research on that. Now, most of them have moderate to severe pain. You know why? Because we've carried children, that's why. Most of them tried the basics, physical therapy, pain meds, cold and hot patches, and some of them were already waiting or even had surgery, like total knee replacement. Now, Doug and I, we were both so impressed with Apos. So listen to some of these findings. Now, Apos demonstrates 43% reduction in healthcare utilization and costs for patients with knee and back pain. Apos Health Breakthroughs Hip Osteoarthritis Patient Study shows 80% of patients avoid joint replacement surgery for up to 5 years. Apos studies reveals 87% of Apos treated patients with knee OA did not pursue further surgical treatment at 5 years. That's absolutely incredible. And Apos has been awarded and honored by the PBGH and the Department of Veterans Affairs. And that is some absolutely incredible, impressive results. Now, when we come back, we're going to be taking a look at my home video where Doug and I met Nina for the very first time. And then we'll also be discussing how both of us are feeling after using this for about 6 weeks now. So we'll see you soon. Well, welcome back. So now here it is. We're going to show you my at-home video, which showcases how we used Apos for the very first time. Well, hello, and here we are at home in Florida, in a different room to I think one that you've ever seen before. And today is a day of many firsts. So I actually don't have anything to unbox. I don't have any skincare to try. But I'm very, very excited because I'm going to have a lovely lady called Nina coming to visit me at my home from the company Apos. Now what they do is they are a non-invasive medical device that personalizes to treat the cause of specific pain by retraining your gait, so how you walk, to help you move better and live better. So if you're like me, you're one of those people that has problems with your knee, then these shoes, wearing them for an hour a day, could help fix that. So not only is it a first time in this room, first time having somebody from a company visit me in my home, but I'm also going to be here with my lovely husband, which you've heard me talk about. And most of the time, he's the one behind that camera when I'm doing my at-home videos. So Doug, come on in. You finally get to meet him. Yes, I am really married. This is him. He's the one that has to put up with me. So we are really excited. Now you're really excited because let's briefly talk about your horrendous knee issues.
Well, I've had numerous knee surgeries. I've had back surgeries due to knee and leg injuries. But right now I'm having some ankle and some knee issues. But I've had 5 different knee surgeries, ACL, 3 meniscus repairs, a joint sac replacement, and a muscle tear.
Oh, she's here, Doug, she's here, Nina's here. Hi, nice to meet you. I'm Sarah Lee.
I'm Nina.
Nina, it's my husband, Doug.
Hi, nice to meet you. I'll be working with you guys today.
Awesome, thank you. Come on in, we look good right here.
Perfect.
Do you need a chair?
Actually, yeah, if you have a high chair, we can use one of those chairs.
Oh, awesome, thanks, Doug. Yeah, awesome. So I have knee issues. I was a dancer for many years.
Which knee?
My right knee. I was training to be a professional ballet dancer, and then I had a cartilage issue around the age of 16.
All right, so what I'd like to do now is I'm gonna watch you walking.
Okay.
I'm gonna give you an app, a phone that has an app that's gonna give us specific numbers on how you're walking while I watch you walk.
Okay.
And then I'm gonna have you try the shoes on, we'll get you calibrated,
Great.
I'll explain what all that means, and then we'll move on from there.
Awesome,
Okay?
thank
All right.
you. This is absolutely fascinating.
Okay, so the speed is 112, which is within the normal.
Oh, normal. That's the first.
110 is the like lower end of normal, right? So we do want to have that increase over time.
Okay.
Right? All right, so I just saw a little bit of a tilt, and you felt it, right?
I did. So is that why I stumbled a little bit?
Yeah, so
Okay.
I'm just adjusting. So every time I make a change, you should feel more comfortable,
Right.
more stable. If
Okay.
you don't feel that way, let me know.
Okay. Thank you.
Velocity's improved. Step length. Single limb support went to 35. Perfect. So single limb support is 35 and 35. Perfectly symmetrical.
Wow.
Right? So
Wow.
that little change.
What was the difference at the very beginning? Wasn't it?
It was previously it was 37, 32. Before that,
Right.
it was 34,
Yeah.
32.
Right.
something like
That's
that,
a huge
yeah.
difference.
So,
Yeah.
so for this week, you're gonna walk a total of 15 minutes every day, starting tomorrow.
Okay.
But at one time, no more than 5 minutes.
And we're now going to bring Doug in for to sort him out, and he has a lot more to be sorted out than I do. That's for sure.
There you go.
Thank you.
All right. So I hear you have a long history. So tell me.
A lot of injuries. I started probably way back. I mean, I've been running since 7th grade, but I danced for quite a while too. But then I got into track and field, cross country, so all my running years. And then some football, but mostly a runner until I got to graduate from high school and started playing rugby for Purdue rugby team, and that caused the beginning of the injuries. And then before the marathoning, I did in a football game, I tore this ACL. So they actually took the middle third of this patellar tendon and used it. I got a titanium bolt here and a titanium bolt here that they reattached my patellar tendon to make the new ACL, and that's repaired that one.
Okay.
Always done pretty good in stage.
All right. Okay. I'm gonna watch you walking. I'm gonna go through the same thing. So definitely less time on the right side compared to the left, right? There's an asymmetry, which makes sense.
Yeah.
Okay, so we want to make sure that we try to make it more symmetrical. So your step length went from 68 to 71 on the right, on the left went from 66 to 68. So we know the back is more comfortable, the legs are more comfortable, single limb support, we've reduced the asymmetry and increased it from 34 to 35 and 36 to 38. So,
Wow.
good.
Amazing.
Okay, good.
Fabulous.
Feels good.
Can't thank Nina enough. Thank you so much for coming all the way out, and I am just so excited to see how much we improve and how better we feel, especially you with your running.
Yeah.
By the time I see you in the studio, I will hopefully be able to give you a bit more information about how I've been feeling and to tell you a little bit more about the fabulous Apos. So thank you, Nina, for coming. I really appreciate it. Thank you, Doug, for being my guest.
That would help.
And I look forward to seeing you guys in the studio very soon. Oh, it was so much fun having Nina at our home. And what's really important for me to mention to you is that not only do you get these shoes, but you get Nina calling you. She's called us like once a week.
Every week.
Yeah, every week. Follow up. How are you doing? So you get all of that, and she's just absolutely wonderful. And what I didn't show you when I was showing you the shoes, and you saw Nina on the video, that these I don't even know what would we call them?
Pods.
Pods. I was going to like little pallets. She was literally, you saw what she was doing. She was actually tweaking them so they're adjusting exactly to our gaits. So, as we said in the video, both of us have had knee injuries. I talked about me as a dancer and how I actually did that was, I don't know if anybody in the 80s used to watch Fame the Musical, and Leroy was the big dancer. Google it if you're young and you don't remember it. So the Fame dance is actually where you go, remember my name, and you do that jumping in the air. I did that and I landed and my cartilage just was destroyed. And from that moment onwards, I knew I wouldn't be a professional dancer, but it's okay. Became an actor, became a singer, and now a TV host, so it all worked out. But Doug, for you, we talked about your injuries, and we both ran marathons. I think I've ran 4 full, about 13 halves, but I'm nowhere near as an elite runner as you are. I mean, running's been such an important part of your life and those injuries, but you've had surgeries, as we discussed. How many again?
5 in knees. And
5 in knees.
1 in the back.
Oh my God, you are Frankenstein. That's why you're so popular at Halloween. Ooh,
Yeah.
like that. So I'm going to ask you tell me in detail of how you felt from the start, from that first day, and as the time has built up, how you felt your improvement.
Well, the first day, of course, it's a bit awkward because they're heavier and then it's like you're walking almost like on the high heels or something. But then now it's part of my routine. I finish my run in the morning. I come in, put them on, do all my morning chores and things for the 15, 20 minutes I'm up to. Swifting the floor, yes. Making the beds, doing the dishes, taking the dogs out.
You're making me look really bad now, like I don't do anything.
But now it's just, I feel uncomfortable not putting them on. Because they feel like, if it wasn't for the pods, they feel like my really expensive running shoes. They're so comfortable and so form-fitting. But now I look forward to it. I'm done with the run. I can't wait to take the running shoe off, put the Apos on, and do my routine.
And by the way, Apos, I know in the video I was saying Apos. It is Apos, like an apple, Apos. So forgive me for pronouncing that incorrectly. So talk about how you actually feel, like the improvement on your knee, your back, and anywhere else, and how, you know, you've been telling me about how your running has been improved.
Yeah, well, I've started to increase my mileage a little bit, increase my speed, because I have been injured off and on here and there, and I have kind of gotten out of highly competitive marathoning, and now more of it's enjoyable running and camaraderie running. But no, I was having ankle problems in the mornings. I wasn't sure if it's from work shoes in the daytime or the run from the morning before. And then I noticed now when I put these on after my run and do my walking around, my ankles aren't feeling the twisted tightness when I get up in the morning. And I look forward to the runs now and look forward to putting the shoes back on. But yeah.
Yeah, I know, I love it too. So for me, I actually had to take a little bit of a small break. So I started them. So my knee just tweaks continually on and off, and a few weeks will go by and there'll be nothing. And I do suffer with lower back pain. But I took a trip to England to go and see some of my family, and I didn't take them with me. They were quite heavy, and I was very limited with what I could take, so I didn't. So I had that week off. And then during my trip, obviously that's 2 long-haul flights, so we know how that plays complete havoc on our bodies. And then a lot of walking around London. And when I came back, yes, there was my knee struggling again, there was my lower back, and I've been back 3 weeks now. And by using the Apos, that has now gone away. I've had no knee pain, and I like to walk at least 3 miles a day, no lower back pain. So I'm like really, really impressed with that. And they really, really are comfortable. You get used to them, and it just becomes part of your daily routine, and it really is like just no effort whatsoever. And it really is wonderful. Nina made us feel just so welcome, and those weekly phone calls now are just a joy to have it. And you just feel nothing but absolute genuine care, which is just wonderful. Well, don't take our word for it. Let's just read a couple of testimonials. So Margaret. My pain level was up to an 8, and I was contemplating surgery. Now it's less than a 1, and I'm able to do things that are important, like spending time with my daughter. That's so important, Margaret. That makes my heart so happy. Robert, the first day I came in here, I cried. Because I could walk normally again. Out of all the treatments I've done, this has been the most effective. It's just heartwarming, isn't it? To hear that people that are really suffering with such chronic pain on a daily basis. And Kathy, before my pain was an 8 out of 10. But since I've been using Apos, I'm able to walk more, and I'm able to enjoy not having the pain that I used to have. Just so heartwarming. And I just really couldn't recommend Apos enough. And I know you feel exactly the same.
I love them.
Yeah, feel very privileged to have had an opportunity to do this, as I do too. Apos Health has given us both back a present, and I love presents. Is it Christmas yet? Is it my birthday? That we really didn't expect to have, and that might be the greatest love of all. Less painful day, more time spending together, our favorite thing to do, go to the beach.
Yes.
And walk the beach, maybe a couple of glasses of champagne in between those walks.
A few.
But we do like those walks. And I really would like to thank my lovely husband for joining me today. It's an absolute joy having you here. Hopefully we'll have you here again. Thank you as always for watching Test Drive Live, where we take cool products for a test drive so you don't have to. Stay tuned for more fun and innovative products coming up next. And I look forward to seeing you next time. Bye.